Hello, everyone, and welcome to 411 on 988, Legislative History and Future Steps. My name is Laura Evans. I am the Program Manager for National and State Policy within Vibrant Emotional Health on behalf of the National Suicide Prevention Lifeline. Just like Schoolhouse Rock, the idea for 988 began with mental health and suicide prevention advocates talking to their local legislators about their great idea, an idea to have an easy-to-remember three-digit number for individuals in crisis. These advocates in Utah took their idea to their representative in Congress, who introduced the National Suicide Hotline Improvement Act. This act was sponsored by Representative Chris Stewart of Utah and was signed into law August 14th of 2018. This law directed FCC to study what three-digit dialing code should be used to reach a national suicide prevention and mental health crisis line, what that infrastructure should require, other logistical and timeline information. So this bill really set out to study and recommend what would be the best way for setting up a national suicide prevention and mental health crisis hotline. The FCC submitted their report to Congress in August of 2019. In their report, with feedback from various stakeholders, including other agencies such as SAMHSA and the VA, mental health organizations such as Vibrant, and others, the report found that 988 was really the best number moving forward using the National Suicide Prevention Lifeline infrastructure for individuals in crisis. And the report laid out the reasoning, FCC reasoning, regarding each number. So for 211, 411, 511, 611. And really the FCC found that given the importance of a national suicide prevention and mental health crisis line, utilizing the existing in-11 numbers really did not provide the needed infrastructure for the public and public awareness of what this number would be utilized for, given that a lot of those in-11 numbers are currently used for other purposes. So this slide really illustrates a timeline of the FCC rulemaking. So you'll notice the August 2019 report to Congress recommending that 988 and the Lifeline be the system for which the National Mental Health Crisis and Suicide Prevention line is operated through. In December of 2019, the FCC initiated rulemaking to actually designate 988 formally as the three-digit number. And then in July of 2020, the FCC finalized the rule and order designating 988 to be made operational by telecom providers with a July 2022 deadline. So it's essentially, throughout this process, you'll see that the FCC really sought input from all stakeholders in making that rule. So the FCC rule is a requirement just for telecom providers to enable the 988 dialing code on all of the telecommunications platforms. So wireline, wireless, voice over IP, essentially saying you have to change the number 1-800-273-TALK, and instead if someone dials 988, they would reach the Lifeline. The FCC rulemaking did not include any of the other provisions that we think about for remaking the crisis continuum. So it's strictly just a telecom requirement that by this July 2022 date, 988 has to be made operational. You'll notice I have more to come here because we anticipate additional rulemaking coming from FCC on some of the items that are still outstanding. And so I'll go to the next slide, and we'll come to the National Suicide Hotline Designation Act. So as the FCC was moving through their rulemaking process, in fall of 2019, legislation was introduced that would require FCC to designate 988 as the three-digit dialing code for the Lifeline. You'll see that there's a check mark there because the FCC already did that in July of 2022. There's also a provision that says the FCC has to complete a 6-month study on the feasibility of providing geolocation or location information to the Lifeline. And that information would be used to ensure that callers are routed to the appropriate call center serving that local community based on where that individual lives instead of what the area code is on the phone number. There's also a provision that SAMHSA and the VA have to complete a 6-month study on what federal resources are needed for a robust 988 implementation. There's an additional study from SAMHSA that they have to complete regarding how to better serve high-risk populations. This includes LGBTQ youth, Alaskan Natives and American Indian populations, other populations that are considered at higher risk of suicide. SAMHSA would have to outline how they plan to serve those communities. There's also a provision that says that states are not prohibited from levying a 988 fee on mobile and IP-enabled services, and that this fee could be used for the 988 crisis centers as well as related services. So this piece of legislation was signed into law in October of 2020. The provision regarding fees is a provision that has been getting a lot of attention, and rightfully so, because in the Hotline Designation Act, Congress did not appropriate or authorize any monies for this new system, or essentially for this new number that will hopefully be coordinated with states' crisis continuum services. So in that in that space of not having any federal dollars, the federal government said, well, states, you can, if you so choose, to levy a fee and use that fee revenue for your crisis continuum and for 988 capacity. So there's several issues or considerations for that that states should consider as they are working through potential 988 legislation regarding fees. And the first one is the state authority to issue fees. So the legislation did not give the states new authority. It just said that states are not prohibited from doing this. That is a distinction that provides states some cover if there were to be a legislative challenge or court challenge to the ability to issue fees. So just knowing that the federal legislation is not necessarily something to comply with, but it's just saying that states, you're not prohibited from doing this. You can do this if you'd like. There's some also additional discussion around the fee in the federal legislation. It says you're not prohibited from issuing this fee on wireless, commercial wireless, and VoIP IP-enabled services. So there's some discussion amongst the telecom community because states already have the authority to regulate wireline, that is also an implicit permission for states to levy the fee on wireline services as well. There's another consideration around localities' ability to issue fees. States typically have the authority to designate that they're subdivisions, so a county or city or other jurisdiction of the state can issue fees. And so that's the same in this legislation as well. States are allowed to give that authority to any political subdivision fee application. Again, this is where we talk about, does this fee apply to all forms of telecommunications? A state could choose to levy a fee on any telecom service that it wants. And how the fee can be used. In the legislation, the fee says that it is for the 988 crisis centers and related services. It does not define what related services are. And again, because it's guidance, a state could choose to fund just the crisis call centers or the entire continuum or one piece of the continuum and not another, as well as fee accountability. So the federal legislation does include guardrails to prevent fee diversion. However, a state, again, can choose to enact legislation that allows them to take any additional revenue raised by 988 fees and use that for non-988 purposes. We would not like to see that happen, but since there's no stick, as you see here in the PowerPoint, the federal government doesn't really have a lot of leverage here. So they're using a carrot to encourage states to use these fees and access this as a way to help pay for 988 capacity. And we'll see when we talk about 911 that there has been an evolving regulatory mechanism for states to ensure accountability for their fees and ensure that the fees are going for their stated purpose. So this map here shows how 911 fees are collected at a state level, and this is as of calendar year 2018. So you'll see here that we have approximately 17 states that have that check mark or kind of diagonal dash, and those states levy both a state and local 911 fee. States that are in solid purple just have one state fee, and states that are in green do not have a state fee, but only a local fee. So again, that county or city or other jurisdiction levies the fee while the state does not collect any 911 funding. So there's really a variety of ways that 911 has been implemented. And again, there are a variety of ways a state could implement 988 user fees. You'll notice that Wisconsin is the only state here in this gray, and that is because they do have local fees that are collected by the telecom company, and the telecom company is not required to remit any of that money collected to their state or local government. So these are certain guardrails that, or considerations when we look at 911 and how we can build on that for 988. Certainly we want to make sure that 988 fees are used for its stated purpose. And even with that over $3 billion generated for 911 fees, the same states report that 911 expenditures or costs for operating their 911 systems exceed $5 billion. So even with that 911 fee that's generating a lot of money, there's still some shortfalls within the funding mechanism. And so that's why we believe kind of diverse funding streams will be needed in addition to user fees. So just quickly looking ahead of things to come related to 988 legislatively, we have the statutory reports that I outlined regarding how to better serve high-risk communities, geolocation, and infrastructure needs. Those are due to Congress from the various agencies April 2021. We're also looking forward to a decision from the FCC regarding texting to 988, which was not addressed in their original order. Then we'll have the appropriations, federal appropriations for crisis services. In this past fiscal year, we saw Congress allocate additional money for the mental health, the SAMHSA mental health block grant just for crisis services. Appropriations for 988 infrastructure, likely based on the report from SAMHSA in April. And then appropriations for the Lifeline, which are used for administration in clinical standards and oversight. Based on those reports, we'll also likely see additional rulemaking, particularly from FCC. Once their report comes out regarding geolocation, they may actually begin to initiate rulemaking similar to the rulemaking they initiated after their 988 report. And then most importantly, the state 988 implementation, including user fee authorization and how states plan to support their 988 system. So you'll see here, I kind of mixed metaphors. with both a speeding bullet train, because 988 has left the station, and July of 2022 will be here before we know it. But also a kind of roadmap or winding path, because there are still a lot of items that we need to consider before we get to July of 2022. So just wanted to give you all the legislative history for 988 and look forward to checking in with you again regarding state legislation. And here's my contact information if you have any questions. Thank you.